Good afternoon, students. Thank you for your patience for the second video of this class, external ear and the tympanic membrane. So we start this tympanic membrane. At first come to the definition. It is oval, thin, semi-transparent, pearly gray, trilaminar membrane which separate external and the middle ear. You all know it is the partition between the middle ear and the external ear, and it is situated at the medial end of the external auditory canal, and it is placed obliquely at the medial end of the external auditory meatus, it making an acute angle of 55 degree with the floor of the meatus. So the floor of this external canal, external ear, are larger than the roof. Then come to the measurement. It is maximum diameter, it is about 9 to 10 millimeter, and the minimum diameter 8 to 9 millimeter, and it is about 0.1 millimeter thick. So it is very thin membrane like structure. Okay, then come to the peripheral attachment of this tympanic membrane. Its margin which is thick and fibrocartilaginous. It is attached to the tympanic sulcus at the medial end of the external auditory meatus. You know the tympanic sulcus, where this tympanic membrane is attached. It is one depressed part in this in the periphery of this external middle end of the external auditory canal, and the sulcus is deficient in the upper part. The sulcus is deficient in the upper part. In this upper part, this sulcus is deficient, and in this region there is the head of the malleus is situated, and from the margin the two fold come to this lateral process of the malleolus. It is known as the anterior and the posterior malleolar fold. So this is the anterior malleolar fold and this is the posterior malleolar fold. This is the margin, and from the margin one fold goes to this lateral process of this malleus, and from this region goes to the lateral process of the malleus. So this is the anterior malleolar fold and this is the posterior malleolar fold. The handle of the malleus draws the tympanic membrane inward. This is the handle of the malleus, and this handle of the malleus draws the tympanic membrane inwards. Hence it is curved with convexity inward. The most projecting point of this membrane, where the handle of malleus is attached, this part, the most convex part of this tympanic membrane, it is known as the umbu. Then come to this parts of this tympanic membrane. It has mainly two parts: the pars flaccida or the flaccid area, the pars tensa or the tense part. The pars flaccida lies between the two malleolar fold. This part is the pars flaccida. This is the fold, this is one malleolar fold, and above it this is the pars flaccida. Okay, it is thin, transparent. This part is thin and transparent and bilaminar. It has no fibrous tissue in between the two layers, and a thin areolar tissue present in this place. It is bilaminar and thin, transparent, and sometimes of accidental perforation may occur in this pars flaccida part. It is bilaminar, and this part is known as the pars tensa, because the lateral process of the malleus, it pulls this tympanic membrane inward, so it become tense. This pars tensa, it is trilaminar, it containing skin, fibrous tissue and mucous membrane from outside inward. From outside inward, it has skin, fibrous tissue, and the mucous membrane, and it is semi-transparent. Okay, so it has two surface, outer surface or the lateral surface, and the inner surface or the medial surface. This inner or medial surface, it forms the lateral boundary of this tympanic cavity, and this outer surface or the lateral surface, it forms this medial boundary of this external ear. Okay, then come to the structure of this tympanic membrane. So it has three layers. From outside inner, it has one outer cuticular layer. It is keratinized, hairless, and so devoid of any kind of appendages of the skin. And the intermediate fibrous layer, it lies in between the outer and the inner layer. It has outer radiating and the inner circular fiber. The radiating fiber lies in the central portion, and the circular fiber, it lies in this periphery of this tympanic membrane. And the inner mucous layer, it is covered by non-ciliated columnar epithelium. In case of pars flaccida, the fibrous layer is absent, and the fibrous layer is replaced by the loose areolar tissue. Okay, then come to the next slide, the arterial supply of the tympanic membrane. The arterial supply of the tympanic membrane, that arises from the branches supplying both the external auditory canal and the middle ear. So the arteries which supply this external ear and the middle ear, these also supply this tympanic membrane. At first come to the outer surface. The outer surface is supplied by the deep auricular branch of the maxillary artery. You all know this medial part of this external ear is supplied by this deep auricular branch of the maxillary artery. Similarly, this outer surface of this tympanic membrane is also supplied by this deep auricular branch of this maxillary artery. And the mucosal vessels, or the vessels which supply this inner side of this tympanic membrane, it comes from the mainly three sources: the anterior tympanic branches of this maxillary artery, and the stylomastoid branch of the posterior auricular artery, and the medial meningeal branch of the medial meningeal artery. So the mucosal vessels, it has mucosal vessels coming from the three sources: the anterior tympanic branch of the maxillary artery, the stylomastoid branch of the posterior auricular artery, and the branches from the medial meningeal artery. Okay, then come to the venous drainage. From the outer surface, the vein drain into the external jugular vein, and from internal surface, vein drain into the transverse sinus and the venous plexus around the pharyngeal tympanic tube. Okay, then come to the nerve supply of this tympanic membrane. You all know this nerve supply of this external ear. The anterior part of this outer surface, the anterior part of this outer surface of the tympanic membrane, it is supplied by the auriculotemporal nerve, and the posterior part, it is supplied by this auricular branch of the vagus. So irritation of this anterior part of this tympanic membrane, it produces spasm of the muscles of mastication, and irritation of this posterior part, it produces the irritation of the vagus nerve. So this causes sneezing, coughing, vomiting due to vagus supply. And the inner surface, and this inner area, it is supplied by the glossopharyngeal nerve. Okay, or the mucosal surface is supplied by the glossopharyngeal nerve. Then come to the applied anatomy part. In case of applied anatomy, in oroscopic examination, ambu is seen, from which one anteroposterior line, this part is the ambu, this part is the ambu. So one anteroposterior line, divide the tympanic membrane into two quadrants, superior and the inferior, and one vertical line through the handle of the malleus. It divides this tympanic membrane into anterior and the posterior quadrant. So these two lines divide the whole tympanic membrane into four quadrants: antero, then posterior superior, antero inferior, and the posterior inferior quadrant. The maximum light during horoscopic examination fall in the antero-inferior quadrant, and this part is known as the cone of light. And when meningotomy is done, when the perforation of this tympanic membrane is done by surgery by the ENT surgeon, then the inferior quadrant, this quadrant is preferred to make a hole on this tympanic membrane. So the chance of to injury of the choroid tympanic nerve is minimized, because the choroid tympanic nerve, it goes to the superior quadrant. Okay. And retraction of the membrane occurs sometimes due to diminution of the pressure of this medullary cavity caused by the blocking of the pharyngotympanic tube, and sometimes the sudden blow to the tympanic membrane, sudden blow to the external ear, it produces a massive air pressure on this tympanic membrane. It produces sudden rupture of this tympanic membrane. It mainly occurs in this region, pars flaccida region. Okay, so this is all. Thank you for your listening. Stay home and stay safe.